Now we have somebody who will tell us about the use of AI in teaching, especially somebody who has been using it in undergraduate teaching. Dr. Bini will tell us about ophthalmology, learning, education and training in the era of generative AI. Dr. Bini ST.
Thank you, ma'am. So I'm going to talk about ophthalmology learning, education and training in the era of generative AI. So I'm going to tell only the basics of use of AI in the teaching. The different AI technologies like generative AI, large language models and chatbots are very helpful in ophthalmology training. It's helpful in UG, PG training, medical faculties and patient education. The key applications are synthetic data and image generation, simulation and interactive training to create personalized teaching materials and curriculum development. The challenges with the AI is it's not always a reliable source for scientific evidence like PubMed. This PubMed gives credible scientific literature. This AI can produce hallucination. That means the information they provide may sometimes be inaccurate, outdated, or even completely fabricated because these chatbots will generate text based on their trained data. That means they reproduce what they have been trained. Coming to the users one by one, we can create simulated patient or we can create patient scenarios for residence training. It can be useful for rare diseases. We can prepare some questions like OSCEs based on the clinical scenarios. So here I am going to create a clinical scenario of 26-year-old male with optic neuritis left eye. And this is the table I got after giving the prompt. So the tool I am using is Gemini. I am giving the prompt. So AI is giving back all the details of a patient of optic neuritis like history, examination findings, diagnosis, management and even follow-up. The medical images can be generated like this. The GANs are used to generate synthetic medical images. It can improve existing images and also it can augment low resolution images into a high resolution one. These images can be incorporated into that clinical scenarios and can teach the residents. The next use is clinical diagnosis. This AI can assess clinical diagnosis. It can be useful for undergraduates and postgraduates. The clinical assistants are chatbots that help you to make a diagnosis. Only thing is you should give the history, symptoms and signs of the patient one by one to the AI. And if you have photos, you can upload that also. The AI will give you back the diagnosis, differential diagnosis, management and follow-up, which can be used for training. You can use ChatGPT, Gemini, Grok or Perplexity, but you can also use fine-tuned LLMs like Lucia. Here I am giving the patient details. A patient presented with redness and pain with anterior chamber cells and flare. So AI is giving the differential diagnosis, management and follow-up. Similarly, the lesson plan can be prepared for PGs and UGs. Suppose I want to create the lesson plan for topic cataract. Total duration I get is 6 hours. And if I give the prompt to the AI, it will give you back the distribution of topics and duration and the activities in each class. Here again the tool used is Gemini. Here I am giving the prompt. It's giving hour by hour distribution of topics and what are the activities we can done in each class. A structured class schedule can be prepared with the help of AI. It's very helpful for MBBS students when we are preparing the class schedule. So in the first half, it's giving all this overview of that class schedule. In the second half, it's giving day-by-day activities. I gave only the prompt like create this class schedule for MBBS students in ophthalmology posting. AI can also assist topic preparation for teachers or faculties. Suppose I want to take a class for postgraduate in the topic keratoconus or for a case discussion, I have to give this prompt. This is the prompt we have to give, or you can modify according to you. And finally, you refer the articles from PubMed to reduce the hallucination. You can use Gemini and Perplexity AI. Here only thing is you should activate the deep research option to reduce the hallucinations. So here I am, here I activated the deep research. This is the Gemini. It started searching. This is what I got about keratoconus, all the details, differential diagnosis, this signs and symptoms, management, investigations, and even recent advances. MCQ can be created in a similar way through AI. It can be used for making questions. You can use ChatGPT and give the prompt like create MCQs about keratoconus for MBBS students. The different difficulty level questions can be created, and or the type of questions you can adjust this knowledge recall or clinical scenarios. All it's according to your prompt. This is a question created by ChatGPT in the topic keratoconus. If you want, you can create explanation for each question also. Or you can use fine-tuned LLMs like MCQ Creator for this MCQs. Question paper can be also prepared with the help of this AI for UGs and PGs. Here I created these questions in the topic corneal ulcer. You can adjust the number of questions like how many MCQs you want, or how many short questions and essays like that. So here it is creating the MCQs, the short questions and essays. You can create the PowerPoints in this AI tools. Here I use the Gamma AI to create PowerPoint. You can edit pictures or add tables or diagrams you want. You can upload your PDF file. And here it is creating the, already created this PowerPoint. You can adjust the number of slides and you can edit whatever you want. You can create posters in the same tool, or can use any other tool to create this one. So here it is, I have uploaded my PDF file and it is creating the poster. The flyers and brochures can be prepared with the help of AI. This is the flyer I prepared with the tool Canva. It will take only 5 to 10 minutes to create these type of flyers and brochures. Patient education materials can be created with the help of AI. Suppose I want to create a leaflet for this contact lens users about the contact lens care. I am giving prompt to the AI. Here it is creating in English and it is in Malayalam here. Here I am getting all the details about contact lens care. You can edit according to your convenience or according to your need. You can generate in these videos or patient education, different types of patient education materials through AI. AI incorporated instruments can be used for this screening purposes like ARDA and IR diagnostic assistant. Surgical performance can be assessed with the help of AI. It's a developing tool called Circlage. You should upload your video and it will give you back a feedback like errors, a surgeon's level of performance and examples of how to improve, etc. So start using AI tools to enhance your education standards and maximize productivity. This will help you to save your time, verify safety and the reliability of AI tool used, and assess the quality of AI contents created. Apply your knowledge and intelligence to modify what AI gives. The best AI users are the ones who remain perpetually curious about what could go wrong. Thank you.
Thank you, Dr. Bini. That was very interesting and something we could actually go back and use. So I want everybody to acknowledge that this is something which you will start using as soon as you get back your OP. And Monday onwards, all your patients will have patient education materials. All your students will have good plans of the teaching.